Okay, so we're back recording. So, John, you were talking about how even in adults you can expand the maxilla, and in an adult, will the mandible also follow when the maxilla is
If
expanded?
you, it usually needs a lot of help because in typical cases, the classic correct occlusion has been lost way back earlier in the person's life.
Okay,
Perhaps I'll tell you briefly about my own experience, how I got to have work done on me.
sure.
My teeth were my teeth were pretty atrocious. When I moved to London from the Midlands of England, my dentist advised me to get to a dental hospital and get work done there. And I went to a teaching hospital, and so I was in the hands of students with staff supervising and inspecting everything. And they wanted to practice making gold teeth. This is back in the 60s,
Yeah.
mid to late 60s. And so I got me a load of gold crowns to replace my horrible old amalgam fillings, which that's a whole other story. Amalgam, don't even take me there. Dreadful. Anyway, um, so I got all these gold teeth. Now, with each crown they made, they took my impressions with me lying flat because ergonomically that's easier for the practitioner. That's fine. I didn't know anything then. I knew nothing. I hadn't even trained in osteopathy then. And I was in an entirely different field. And anyway, I discovered years later that what that had caused was the gradual pushing back of my mandible. Because I've been lying flat, gravity pulled the mandible back slightly. Every time I took an impression, every time they took one tooth out to replace it with another, salami sliced my jaw back into what we call a class two. And I noticed about the time I started to get severe TMJ symptoms, I was getting quite severe dizziness, vertigo, for no apparent reason. And I came across an old photograph of me age 17 where I had quite a pronounced mandible. I had quite good occlusion despite my teeth being terrible. And what had changed that? And I figured out it must have been all that work I had done in the chair lying back. Um, so anyway, that drove me into a class two. And when I started getting these symptoms years later, I can tell you when it was probably about 1993, I started getting these horrible vertigo symptoms and stuff and feeling ill. One of the people I'd worked with, one of the people I taught actually, is a very good dentist over in Glasgow. And he started treating me and sorted it all out. And among other things, re-widened my maxillae, helped to restore my bite, and the symptoms went. And so that was very interesting. Received wisdom is if you don't get the maxilla by the time the person's 15, you're too late. This is what the orthodontists say. Of course, that's nothing to do with pulling business forward. Slight pause there.
Hmm.
But, you know, that taught me a heck of a lot. There's nothing like going through it yourself. Now, nothing as severe as the sort of thing you and the people you're trying to help has experienced, Omar, but it did give me an insight into generally poor dental practice. And
Hmm.
so that's where I started getting into it in a big
Okay.
way.
So I have two questions. First question is, in an adult, so you said you can widen the maxilla. Can you bring it forward?
Yes, only as far as nature would like it to go. In other words, what you're doing is attempting to restore homeostasis. You know, homeostasis is the perfect functioning body for that person.
Yeah.
Um, all we can do as craniosacral practitioners and as good dental practitioners is to remove restrictions to natural growth. Nature does the rest of the work. It's as if DNA is an active influence all the time trying to put us right. But stuff gets in the way, like what you've described, that prevents that happening. And this is happening throughout our lives.
Yeah. So how would you pull someone's maxilla forward?
Well,
Like,
firstly with my hands. I put a latex examination glove on, attach myself to the biting surfaces of the upper teeth, or if there are no teeth, to the gums, the
yeah.
dry gums, and exert. It's a standard proven technique. Exert a pull in an
Like this?
anterior direction, and you wait for, well, two fingers normally, depending on the size of the mouth. But they have to engage the teeth to get a really good. Sorry, they have to engage the teeth to get a really good purchase. But there's a standard routine of technique. Some I haven't ever added them up, but 10 or so techniques that I teach my students as to how to evaluate and manipulate for freedom the bones of the mouth and face. And that includes nasals, cheekbones or zygomata, the palatines at the back, the vomer that sits behind the nose above the palate. All of those need freeing up together with the rest of the cranium because they all interact. So we free up the whole environment and keep it free with regular visits while the dental work's going on. And that facilitates regrowth and makes sure that it's even and as homeostatic as possible.
And how regular should these visits be?
Depends on the individual.
Okay.
Could be anything from every other day to every month or so. It depends how they're doing. People vary enormously in their response. The point about this is there is no cookbook approach. And what we're fighting here, what we're trying to correct and compensate for, is a cookbook approach that no way takes the individual into account. The way we work with craniosacral therapy, basically, and this may sound outrageous, is to get our hands on and let the body tell our hands what it needs. Now, it works, and we're using very light forces that the body helps us to determine. So it's as if each person, I hope I can use this kind of language with you, as if each person has an inherent treatment plan,
Yeah.
which is exactly suited to what they need, precisely and uniquely. And getting our hands on, and with our hands asking the right questions, interrogating the tissue, letting it show us what to do on that particular day for that particular person. And it may be different next week. So all the time, it's like a child's mind. We don't know. The most important thing we can say as practitioners is we don't know. And I say that to people. They say, how are you going to treat? What are you going to do? I say, I don't know. But I'll let you know in a few minutes when I've had my hands on. So we're always listening for that unique information. I know that's getting almost into the theology of how we work, but it is so diametrically opposed to the orthodox. And it is, when you think about it, profoundly scientific.
And so you have brought people's maxilla forward.
Oh, yes.
Wow.
Anytime.
Are we talking
Now,
few
now they
millimeters?
may need dental assistance to maintain it.
Okay.
But yeah, I mean, it's a standard routine. Now, whether that's measurable or not depends on the individual. Very often it's surprisingly measurable. I can also tell you this, Omar, and this is very telling. Quite often, I'll do a sort of standard craniosacral treatment on a person, which is in theory standard, but for each person the moves are unique.
Yeah.
And without touching the face and palate at all, or the jaw at all, I can sit them up and say, just test your bite for me, and I'll tell them how to do that. They have to be nice and straight and very lightly bring the teeth together. So how does that contact feel? And they say, oh, it's strange, it feels different. I say, how different? And they'll quite often say, there's more contact all round, it's more even, especially if there's been a dental issue. So everything feeds in to the palate. And I have colleagues, one particular I remember, the first time I had a dentist on a first level craniosacral course, I asked him, I said, Sean, because that was his name, Irishman, how do you start evaluating a dental client? And he said, well, I start at the feet.
Because you're looking at posture.
Anything, everything. I start with the feet. I want to know what's going on there, what's not working there.
Yeah.
Nothing is left out. And that is good dental work. Now, of course, this is total heresy as far as the dental establishment is concerned. It's nonsense. It's ridiculous. But you know, as long as we see different people for our teeth than we do for our general health, I think that's going to persist.
Rather than ask you,
I hope I haven't led you too far off your.
No, you haven't, because I was going to ask you a question, but I don't want to put you on the spot. No,
but try, and I can always slide out.
Well, okay. I believe that dentists should be doctors first.
Yes.
And
100%.
And I always ask myself, like, you know, when I go to the doctor can he's qualified to examine, you know, and work on various, you know, body systems and body parts of mine, but not the mouth. I have to go to a dentist. But a dentist hasn't gone to med school. I feel really bad right now because I'm not trashing the industry. I don't want to get shot, actually, that's the truth. But I mean, yeah, should dentistry kind of
Well, that separation is
Yeah.
unscientific. It is untherapeutic. It's counter-therapeutic. Clearly, it's obvious. It's the
Yeah.
elephant in the room.
Yeah.
When I was a little kid, it just so happened that my dentist was also qualified as a doctor, but this is before the age of state medicine and stuff.
Yeah.
But unfortunately, I wasn't with him long enough for it to be of particular benefit. But he did suggest I got my tonsils removed, which I got. That's a whole other story, nothing to do with what we're talking about.
Yeah. Yeah.
There are some good ones there, some good dentists who take a whole person view, no doubt.
Absolutely. Yeah. My dentist, for example,
But that's
now.
not what we're talking about.
Yeah. Yeah. Yeah.
You had another question. I'm sorry.
Well, some people who, or I guess a lot of the people with right to grow, they have sleep apnea. I have so many reports of people who wore headgears and now have sleep apnea, and they're always asking, what can we do? And one of the things I'm looking at having done is the maxillomandibular advancement surgery, but I'm afraid to do that because I don't know if there's a long-term consequence in terms of the relationship between the bones and the maxilla and the sphenoid and
Absolutely, always.
okay.
You cannot. In fact, I'll go further than that, Omar. You cannot alter one part of the body without the whole of the rest of the body feeling it to some extent. Whether or not that leads to dysfunction depends on a million factors,
Yeah.
a million possible factors. But and now, the more locally you get, the greater the effect is likely to be. In
Yeah.
other words, the effects in the head are more likely to be obvious, perhaps, than the effect on the belly or the bladder or the feet.
Right.
But they may not be as severe. But logically, yes, of course, the first place you would look is the rest of the head. But remembering that the rest of the head contains the gizmo that controls the whole system anyway, which is called the brain.
Yeah. Yeah.
Kind of close.
Yeah. Yeah. Okay, I'm gonna pause.
Is this being helpful?
It is. I'm gonna pause the recording.
As to the question, what can an adult do who's in this situation? I can separately send you contacts for various facilities which are North America wide and are very highly populated, of
Okay.
practitioners who can do the body work,
Yeah.
who will almost certainly know good dental colleagues. Also, I believe one of the people who signed your petition was my friend and colleague Noel Stimson,
Right.
who edits, I think he still edits something like this, or edited its predecessor, which is the quarterly journal of our community that is interested in whole person dentistry.
Yeah. Yeah.
Noel has a lot of contacts and a lot of influence and a good network. So,
Yeah.
and he will know people in the States because they frequently come to the UK to demonstrate and lecture more safely and freely than they can in their own states very often.
Wow. Wow.
So there are
Okay.
lots of resources.
Cool. I'm gonna put the recording on pause for a sec. The file's getting pretty
Okay.
big now.